What is deep brain stimulation therapy, or deep brain stimulation surgery, or DBS for short? So deep brain stimulation surgery or therapy is a treatment where we put a pacemaker-like device in a patient with tremors or Parkinson's to improve their motor symptoms or physical symptoms. So the process consists of placing a wire in the deep part of the brain, the tip in the deep part of the brain, and the wire comes out of the skull through a hole and then runs under the skin down into the chest, where a pacemaker like battery is placed, hooked up with the wire in the brain. The tip of the wire has these contacts or naked areas where electricity can leak into the brain, and when placed in the right spot, as the battery is turned on to give a little bit of electrical current into the brain, it results in improving the symptoms like tremors or walking or movements or stiffness or speech, among many others. The deep brain stimulation surgery therapy has been FDA approved for essential tremors since 1995 and has been approved for Parkinson's disease since 2005 and is now a very commonplace therapy. There are over 150,000 patients with the DBS device implanted in their brain with the batteries in the chest in the world, or maybe that many in the United States alone now. This was a therapy that was pioneered in the United States but is now being used also in Europe, although it's considered somewhat of an experimental therapy in Europe, but is an established therapy in the United States. It is FDA approved, it is covered by insurances for these indications, essential therapy and Parkinson's disease, and is also FDA exempt for dystonia, generalized dystonia, and is covered by insurance for that, and is being considered for or was recently approved for resistant epilepsy, and is being studied or being considered for resistant depression, and has been used experimentally for many other indications or many other types of conditions.